Right, so I need to talk about something that affects millions of men across the world, and that is these angry looking bumps that affects the jawline after shaving, well, typically after shaving, also known as razor bumps. And I'm not talking about minor irritation across the jawline. What I'm referring to is these angry red bumps that sometimes turn into swollen lumps, discharging pus, and in very severe cases, this can result in scarring as well. The medical term is called pseudofolliculitis barbae, and essentially this means fake inflammation, hair follicle of the beard, but there is nothing fake about how uncomfortable and distressing this condition can be. Hi friends, for those who don't know me, I'm Chris. I'm a UK trained dermatologist, and on my channel I talk about everything to do with the skin. And in this video we're going to talk about what razor bumps actually are, how do we prevent them and treat them. And here's what got me interested in this topic. Razor bumps are not just a cosmetic issue. It is actually quite distressing and uncomfortable to a lot of patients, and this essentially highlights how mechanical injury can further exacerbate an inflammatory reaction, and the solution behind this is not just simply getting another razor or stop shaving completely. It's about understanding your skin and how to work with it rather than against it. So let's start with the basic. What exactly happens in razor bumps or pseudofolliculitis barbae? And here's what's really happening. When you shave, you're not just cutting the hair itself, you're also causing microscopic trauma to the skin. And when hair starts to grow, it sometimes, instead of growing outwards like it should, it sometimes curls inwards into the hair follicle, causing swelling, inflammation, and this presents as the red bumps you see, which can be quite painful in nature. Your body reacts to these trapped hairs as foreign substances, and it essentially triggers a whole inflammatory cascade, leading to further inflammation. And here's the other thing, genetics do play a role in this. People with naturally curly hairs tend to get this because when the hair starts to grow, they curl back in, causing the inflammation. And this is why razor bumps often happen in men of Afro-Caribbean descent, but it can also happen to anybody with curly or coarse hairs. If you are someone who is prone to getting razor bumps, here are some things you can do at home in order to reduce the risk of this happening. The first thing you want to do is to consider softening the hairs on your face before you shave. Now, I'm not talking about just splashing a few splashes of water on your face before shaving. You want to either steam your face from taking a hot shower or even use a hot damp towel to soften the hairs on your skin in order to make things more easy for shaving. Next, exfoliation. And this is huge for preventing razor bumps. You want to use an exfoliating agent like AHA or BHA, so glycolic acid, salicylic acid, or even lactic acid. It helps remove the dead skin cells by exfoliation, and this creates a more smoother texture on your skin for easy shaving. Products like the ordinary glycolic acid toner, Panoxyl body wash, or even the CeraVe cleanser can work quite well here, as long as you have the right active ingredient. Now on to the next shaving technique, and here are some of the tips and tricks you might want to employ when you next shave. First, as mentioned before, try to shave on damp hydrated skin because you want the hairs to be pliable for shaving. The next thing you can do is to use a shaving foam or gel containing more soothing ingredients like aloe vera or glycerin, and avoid harsh ingredients that can irritate the skin, so like menthol, peppermint, or any fragrant product. Another tip I have, and this might sound controversial, is to use a single blade razor as opposed to the multi-blade ones. The idea is with single blades, they are less likely to cut the hair too short, whereas for multi-blade razors, they sometimes cut the hairs just below the skin surface. So you can see where the problem would be. When the hair starts to grow out, it might not come out of the skin, rather it might just curl back in, causing inflammation. That said, you might see on the market newer razors with advanced technology and models and guards to help prevent this from happening. So it's always good to have a wander around the shaving aisle and to look at what the latest products are. The other tip I have, which some of you I'm sure may not like, is to go with the grain rather than against it. And the idea is you don't want to get so close of a shave that you get ingrown hairs as a result. And finally, use short, sharp strokes and keep your blade clean, because you definitely don't want a rusty blade or a blade that's filled with hairs, which is not going to help with cutting the hairs on your face. Post-shave aftercare is as good as pre-shave aftercare. So avoid alcohol-based aftershaves because they just simply add to the irritation. Instead, look for bland moisturizers that can help soothe the skin, or with ingredients that are anti-inflammatory like niacinamide. But what if prevention isn't enough and you're already dealing with razor bumps? Well, you've got several options to consider depending on how bad your symptoms are. So for inflammation and redness, anti-inflammatory is your best friend. So if it's really red, swollen, angry looking, a bit of a steroid cream like hydrocortisone might help do the trick. Of course, you don't want to use it long term because it can cause steroid side effects like thinning of the skin. The other thing you might want to consider would be anti-inflammatory ingredients like niacinamide, which helps with the redness as well. And I will link some of the products in the description box below. And again, with itching, you might want to consider moisturizers with anti-itch ingredients containing things like lauromacrogol or urea to help soothe the skin. For embedded hairs, ingrown hairs, you might want to consider exfoliation. I would personally avoid physical exfoliants because you don't know how much trauma you're causing to your skin. So go opt for chemical exfoliating acids, as I've mentioned before, AHAs, BHAs, and even retinoids, which are vitamin A derivatives, and they help normalize the cell turnover rate and makes it less likely for your skin to clog up. And for hyperpigmentation, which sometimes can happen after inflammation, especially in darker skin types, you might want to opt for ingredients targeting these pigment or melanin. So ingredients like azelaic acid, kojic acid, arbutin, and licorice extract can help minimize some of the pigmentation left behind. So for infection, depending on the severity of it, just because the skin barrier function has been impaired and bacteria can get in, topical treatments can be helpful containing ingredients such as benzoyl peroxide. But for more deep-seated infection, you might want to get yourself a course of antibiotics from your healthcare professional. And as for recommendations of products to use, I have listed them down in the description box below. Sometimes, despite your best efforts, you might need professional help, especially if you're getting scars like keloid scars, which are large, bumpy scars that are quite disfiguring, recurrent infections, hyperpigmentation. Maybe it's time to consider seeing your own local dermatologist. And what we might do would be to offer topical creams like topical antibiotics, stronger forms of retinoids to help exfoliate the skin, oral antibiotics for its anti-inflammatory properties, and sometimes we might also consider a course of Roaccutane or Accutane to help dampen down the inflammation and help exfoliate the skin more. And if you're looking for a more permanent fix, which I understand may not be for everybody, you might want to consider removing the hair itself, so laser hair removal or hair electrolysis, which offers a more permanent solution. There are, of course, other ways of removing hairs, so you might want to consider chemical depilatories, and these creams might actually cause more irritation because of the harsh chemicals they contain, and so it's not something that I would often recommend. And of course, you can also opt for an electric razor rather than a manual one, but they tend not to give you a close shave. Although there are many razors out there which are electric with a guard, but they do very good close shave as well. If you found this video helpful and the tips practical, please hit the thumbs up button and comment in the comment section down below to see what you would like to watch next. Thank you for watching and see you next time. Bye!